Kia ora. I really want to welcome everyone here today and thank you for coming and listening. I don't really feel qualified to be here and talk about equity, but I was asked to come and talk about Waka Wahine Hauora. We've been being developed for probably about 2 years now. We've actually been up and running for just 5 months. So who are we? Well, we're a non-profit making organisation. We have a bus. It's actually really just a big, posh mobile home. And the reason why we set ourselves up was because I was working in Dunedin Hospital as a gynaecologist, and I met many, many women who were coming down, particularly for positive cervical screening. And they travelled 3.5 hours to see me, and they were going to travel 3.5 hours back. And I really became unsure of the fact of whether I was improving their healthcare or increasing their risk of dying driving on our roads. Then they'd tell me their stories whilst they were having their colposcopy, and they'd tell me how their whānau was outside and they were going to have to stay the night because their clinic appointment was at 3:30 and they didn't have time to get home and the kids were not able to go to school. And I really started to think this was a little bit crazy, so I started to talk to them and ask them how would they think if actually a bus had come to them and they'd had their treatment on the bus. And they said, oh, well, that's great, but can I have my contraception and my prolapse and my everything else that I want to have managed on the bus as well? So the planning went on, and we talked to lots of people and we developed a bus. Sorry, gone massively forwards there. So the bus has got a little bit of press as it's been going through, but that's really because we had a lot of community engagement. We went out and we engaged with New Zealand rural women specifically, but also any medical practice that would listen to us, anyone who wanted to talk to us. We felt that it was really important that we heard what they wanted. So the big thing was that it must be sustainable. Apparently we used to have a tuaka, and the waka used to go around and provide various services in Otago, but it disappeared and stopped being funded. So they really wanted a sustainable funding model. At one of our lunch meetings that I was having, where I went up to see the New Zealand Rural Women Group at Waka Wahine, someone said to me, what happens if you get run over by a bus? Okay, good point. So you really have to think about that when you're developing these projects, and you really need to think about what matters to the community and how are you going to achieve that. They spoke about the fact that there was an issue with access, and they didn't want to have to go and see their doctor to talk about their sexual reproductive health to come and see us. So we made it so that there was self-referral. We had a fortunate incident when we received the bus. It was white when we received it, and so it was going to have the logo that's on here, right? This one up the top, with all the names, but we didn't have enough money. And also at that time, I had the opportunity to actually consult, particularly with some Pacific groups who said they really wouldn't want the name on it. So now we just have the logo of the wheel, and there's a bike rack on the back, so it looks like a camper van. And we've now discovered that not only that, you need to park it so that the door is not facing the health institution that you're parked at, so people don't see someone walking in. And these things are really, really important when it comes to actually engaging and enabling people to actually attend for care. We also discovered that different areas would require different services. So in Oamaru, at Oamaru, in the north of Otago, the women there, they're elderly and they can't drive down and get their care for their prolapses. So there we provide a lot of prolapse care. But in central Otago, we're really needing to provide much more contraceptive care because there's a lack of availability of long-acting reversible contraceptive. So there we're now training, and we're training nurses. So we're heard what the problem is and said, well, we actually need this to be in the community, not just in a bus that comes around once a month. We also note that there's different costing models, so we're talking about equity here. And people challenged me and said, how can you charge a different amount of money for something? But I think it's that those raising of the shoes. So you've got to get everyone up to the same level. So therefore, you need to talk to people and hear what they're going to say. So the women are able to choose what funding model they want to pay, and they can also pay us more if they want to. So we have some women who have insurance but also pay as a social enterprise, so they pay for someone else. So we're using a number of different mechanisms for trying to level the playing field and improve equity of access. These were our goals, and they sound all audacious, and we're nowhere near there because we're only in for 5 months. But what we have done is we've gone down and we found some areas where there's some significant issues in terms of accessing care, and we're working with researchers to work out if we can improve, for instance, self-testing for HPV rather than smears, whether we can go down and do services funded by the DHB or through trusts in the region. We are managing to reduce the travel burden. We're now going to 3 areas, and we're just planning to spread out to 5 very soon, and hopefully we'll be able to improve that. We are also consistent with the national agenda of keeping health in the community closer to home, but we want to do more there, and what we want to do is train. So particularly with Marina having become funded, one of the things we're doing is we're going out and offering training. We've also been training some of the nurses in terms of Jadel insertions. So we're trying to hear what do the community needs. I've had a number of emails in the last week saying, can you please come and train us? This is what the bus looks like inside. We basically can do anything that would be done in a gynecology clinic, but hopefully we'll be able to move on and do more as we train people in the community and they don't need us for instance, contraception. It's really, really important that we continue engaging with the community. So we've been trying to work out mechanisms for doing this. We've been driving around to various areas and just literally having days to show off the bus. This is me heading down to Tuatapere, and I had the opportunity of a lovely sunny day, and so we took a picture heading into Queenstown. But we hear from people through our Facebook, and that enables them to tell us what we're doing right and what we're doing wrong. We also have a website, and we're just about to put up a survey for our patients as voluntary so that they can tell us. But we really need to engage with that, and I think that that's probably one of the big things is if you're going to talk to people, you have to listen and you have to hear. So our future plans are that we're aiming to design a model that will be sustainable. So we're planning to be nurse practitioner led. We'll have gynecologist support by audiovisual. I'm travelling all round at the moment, but I have to recognise that someone else might not want to do it, and I don't want a system that's going to fall over if I get run over by the bus. We're planning on having a second health practitioner, so you always have to have 2 people on the bus for safety of everybody. But we'd like them to be from the community so that when we care for someone, we leave that care within the community so that helps for everybody, but also improves training. We'd like to set up a charity that sits above us and that is got a guiding principle that's similar, so therefore we can improve our sustainability. And we'd really like to provide more specialist services. So one of our things is to think about how could we reduce time in terms of diagnosis of cancer. And so we're looking to add specialist services that we can provide safely on the bus. Thank you very much.